Howdy, folks. Thank you very much for joining me today in this live webinar. Or I consider it a class teaching you. And today's subject is understanding and treating hypertension according to Ayurveda. So, we're going to cover the different causes, or we could even say types of hypertension, because you cannot treat your high blood pressure unless you know uh, the cause, what caused it. And the cause basically determines the type of high blood pressure according to Ayurveda. Now, we're going to simplify things for this class sake, but it's very important for you to determine from this talk what is causing your high blood pressure. That's what you should be thinking, not what could I drink to get rid of my high blood pressure? People try hibiscus tea and things like that. But if you don't know why you have it. So then we'll also talk about the dietary guidelines. But of course, we're going to break this down into at least 3 different causes. So somewhat, I have to give you 3 different sets of dietary guidelines. So that's going to be quick. But I'll hit the main foods that aggravate or contribute to that type of high blood pressure. And so there was some home remedies that, but once you understand what type you have, a lot of things make sense to you on what to do as far as the diet and the home remedies and things you may have to change in your life. Because once you know what causes your high blood pressure, then you know what type of high blood pressure you have, and then the diet and the home remedies will be clear for you. And then I'm going to show you how I treat these different types with completely different herbs. I can have 3 people with high blood pressure and give all 3 people different herbs. So this whole concept, hey, can I have some hibiscus tea for my high blood pressure? What should I take for my high blood pressure? This is a false thinking. And this is why a lot of people are not successful in treating themselves for a lot of health conditions, because they just go out thinking, okay, I have high blood pressure, I have high blood sugar, I have insomnia. What should I take? What herb should I take? In my business, of course, I get these calls, or my staff does. I don't really answer the phone anymore, but they say, they always ask, if they get me on the phone, that's what they want to ask. What can I take? Just give me what you gave my uncle. You got his blood pressure under control. He took your herbs for 3 months, and now he's not taking any herbs, and you got him off his med. Just give him the same thing. I don't want to do a whole appointment. I'm sorry. Doesn't work like that. One, you could have a different type of high blood pressure. You could be causing the high blood pressure. So I need to investigate what you're doing to see if you're causing it. And for sure you're causing it, but you don't know. So I hope you're interested now after that little introduction. But it's a very important subject. And you have to be very careful just getting on high blood pressure medication thinking everything is going to be hunky-dory and you're just going to take this blood pressure medication for the rest of your life. Well, you better read the small print about the side effects. I'm not a medical doctor, so I'm not going to go into those. But I do see a lot of people coming to me with kidney failure who they've contributed, and the doctor has contributed to their blood pressure medication. So even you're taking blood pressure medication and your, quote, numbers look good, doesn't mean that you're not going to have kidney problems, liver problems, and other issues. And you may still have spikes in your blood pressure that can cause cardiovascular problems and kidney problems as well. So it's better to treat it naturally, change your diet, change your lifestyle, take some herbs for 3 to 6 months and get it under control, because you don't take herbs forever. Now, some people continue to take small doses of these blood pressure herbs for a while, but initially they have to take quite a bit in the beginning to get it under control. And it's gradual. You don't take a spoon of herbs and drop your blood pressure like a medication. You got to go slowly, gradually, and then it gets under control. And if you're on medication, of course, you usually have to take both at the same time until the herbs and your changes to your diet and your lifestyle take effect. And then slowly your blood pressure will become lower, and you can wean off the medication. And then ultimately you can wean off even the herbal remedies, because the herbal remedy and removing the cause, which partially you're doing, with your diet and your lifestyle. By removing those, plus taking the herbs that actually help your cardiovascular system and address these underlying causes, means you've truly treated it. You're not masking it up and just having think that you've got your blood pressure under control. If you're taking any medicine at all, you're not healthy. So don't fool yourself. And if you're taking blood pressure medication every day and without it, your blood pressure goes very high, you still have high blood pressure. It's not going to damage your arteries or give you a stroke because you're taking the medication. It may be thinning your blood, etc., or beta blocker. But you still got the health problem. The health problem didn't go away. You're just like, it's not giving you a stroke and a heart attack, so you're able to keep on going. But the underlying causes are still there. So I know you're now excited to know, well, what are these types? Now, we're going to simplify it down because there's many different types of high blood pressure. And then once you know the types, then we can look at common causes for each type. So in Ayurveda, of course, is a very advanced, sophisticated system that's very individualized, and they look at every health condition as imbalances between the doshas of Vata, Pitta, Kapha. So we could say the three major types of high blood pressure in Ayurveda are Vata, Pitta, Kapha. So let me explain. Vata type of high blood pressure goes up and down very easily. It's related to the nervous system. That's the white coat syndrome. That's why I never wear a white coat, because it would increase people's blood pressure, apparently, because they go to the doctor, they're nervous, they heard all these, they know that, medical care is the third largest cause of death. They're a little nervous. And so then their heart rate goes up, they breathe a little faster, their heart beats a little faster, their blood pressure goes up, and then the doctor comes in or the nurse comes in, measures your blood pressure. Oh, it's high, and you're on medication. So the cause in that case was based on your own nervous system, anxiety, worry, overthinking. Pretty common cause. And unfortunately, a lot of people are on medication, and that the cause was just stress at work, stress in life. And of course, we'll talk about what increases those. So then, of course, in that case, you want to get rid of everything that's stressing you out, pushing up your, affecting your nervous system, like coffee. Coffee is probably one of the worst things for high blood pressure, particularly if your blood pressure is going up every time you get anxious, and then you're drinking coffee all day and you got caffeine pumping through your blood, and you're always on the edge because you're buzzing on your caffeine, and then something happens, and then you get panicky and worried and nervous, and your blood pressure goes up. So that's the first type, Vata type, related to your nervous system mostly. There's other causes. Even constipation can push up your blood pressure. Kidney issues can push up your blood pressure. A lot of foods can push up your blood pressure. But probably the biggest cause is coffee, particularly this nervous type of sensitive Vata person. And you could always tell their blood pressure goes up and down, up and down. It's really erratic. They could be home relaxing on the weekend, and they don't even have to take any medication, and their blood pressure doesn't go up. Other days, they're taking their medication, and the blood pressure is still going up. It's kind of hard to control, even with the medication, because it's connected to their mental state and their nervous condition. Okay, so that's the Vata type. We'll go back to it and talk about how to treat it. Second type, Pitta. Pitta, of course, is pretty much, we could say, an inflammatory type. The arteries are inflamed, and this inflammation makes the cholesterol build up, and you can get a blockage. So generally, this person, they have muscle inflammation as well, just like the Vata person. They're probably not sleeping good. They got anxiety. So, I can determine this like right away, because they also have other symptoms. Like the Vata person has anxiety, poor sleep, insomnia, and now they come to me with blood pressure. So we already probably know that's one of the causes. There could be multiple causes. We're just kind of breaking them down here and covering the three major ones based on Ayurveda, Vata, Pitta, Kapha. So the second type, Pitta, is inflammatory arthritis, and that type of person will have the red ears, the red face. There's anger pushes up your blood pressure, just like the anxiety pushes up the blood pressure for the vata. You know, the mad pitta, he's yelling, he's screaming, maybe he's in the military or he's a police officer where, you know, he ends up having to yell and get mad. So then his blood pressure goes up. Of course, alcohol will push it up too, because alcohol has pitta increasing quality. So anything that's like hot spices, chili peppers, this will all push up this type's blood pressure. And this type of person is easy to spot. They're red. They're basically a driven person. A lot of business people, very successful people, very motivated people, very, driven people, hardworking. See, they got that. Their hearts are good. They're pumping hard, but everything starts to get inflamed and hot, and that's creating their blood pressure. But almost inevitably, the people have muscle pain and joint pain too, because the heart is just a muscle anyway. So it's your heart muscles get inflamed. Your joints are also inflamed. See, some people say, "Oh, I don't even care about my joint pain. Just get my blood pressure down." Well, they're all going to come down together in that case, because your muscles are inflamed and your heart is a muscle. So I give you anti-inflammatory herbs, and that will help to bring down the inflammation, which is the cause, which is completely different than the nervous sensitive vata type. And heat also is a factor with this pitta type. Inflamed and hot. That's why their face becomes red, their ears become red, the veins are popping out, and the blood pressure that's a very dangerous type of blood pressure. These are the type that get the strokes and the heart attacks, particularly when they get mad. And then the third type is based on kapha imbalance. Kapha vrudi, kapha's to imbalance in the cardiovascular system, which would include the muscles and the whole circulation. So kapha type is a blockage, also very dangerous. There's a blockage in your arteries, and if you keep going, you're probably gonna have to put a stent in and do a heart bypass. And that person usually is overweight. And they also have other blockages elsewhere. They could have constipation. They could have cholesterol issues, thick blood. They have a lot of high cholesterol, so the blood gets thick, and that can create blockages. And they also can have like gallbladder congestion. So there's often other signs of congestion, like gallbladder congestion, constipation, and lymphatic blockage, poor circulation, which can be easily seen by just having cold hands and feet. You got really poor circulation. And, that type of person, they can feel a chest pain. And that's the pressure from the blockage in their arteries. So those are the three main causes. Again, there's a few other ones. Even kidney issues can push up your blood pressure. Even constipation to some degree can push up your blood pressure. Oh, shit. Oops. Uh-oh. We got a technical problem here, folks. Cat just jumped on the keyboard. Let's see. Oh, we're still there. I'm afraid we blew the recording, though. I'm glad you folks are still there. Cat jumped on my keyboard. Oh, well, so much. This video won't make it up on YouTube. It's had a problem. But anyway, we're back in the show. That was a little kitten jumped on my keyboard, but lucky he didn't hit the right key. So we are still going. So those are the three types, vata, pitta, kapha. And now let's talk about what's causing those types. Back to the vata type: anxiety, nervous stress, coffee, chocolate, stimulants. Chocolate's inflammatory and a stimulant. So it can push up your blood pressure. And just stress, anxiety, pressure, overworking, not sleeping, all of these affect the vata type, including constipation. So they're blocked up. They get a lot of gas and bloating. Think of all that bloating. It's making your abdominal area bloat out. I mean, that's creating pressure and pushing up against your circulation system. And the Vata type also, they have the cold hands and the feet, small, and their heart's very sensitive. It can race. So that type of person has to stop the coffee, has to stop the chocolate, have to stop the stimulants, has to not stress as much, and then they will be. That's the change that they have to make. And they also should not be skipping meals, because when you skip meals, you don't eat all day, then you have more stress, more anxiety. And that person, they have to sleep. So often that type of person, I'll give them some, not just the heart herbs. So let me talk about those heart herbs as well. But I'll also give them something to just help them relax. And we can thank our sponsor here, Herbman Teas, providing us these teas and paying the bills. There's a tea by herbmanteas.com called Chill Out Relaxing Tea. And I'll give them this as well. Even though I'm treating their high blood pressure, I know the cause is their anxiety. So I give them herbs to just relax. Just like if I was treating somebody with high cholesterol, the other type, I would also try to, the kapha type, I would just give them this tea here for high cholesterol. It reduces cholesterol, helps liver function, and supports the cardiovascular system. So I have other herbs I would give specifically for each of these types, but I would also include supplementary herbs for the anxiety, in this case, for the Vata type, and maybe some sleeping herbs, which I didn't bring here. But herbmanteas.com, they do have sleeping herbs, relaxing herbs, all types of herbal products for every health condition. But so I would probably give sleeping herbs, relaxing herbs, plus the blood pressure herbs, which I'm going to talk about in a minute. But let's go to the second type again, the Pitta type, the hot, angry, driven guy whose blood pressure can get very high and very dangerous, is that that's inflammation. So not only would I give them some herbs that are just for, I'm going to show you some different formulas for these different types in a minute, but I'd also throw in some anti-inflammatory herbs, because I know that's the cause. See, I mean, that in itself isn't reducing the blood pressure. This is used, it looks like turmeric. Everybody thinks it's turmeric, but you can see the bright pink, orange spots. That's actually curcumin. But the first ingredients actually is frankincense. Boswellia is the extract of frankincense. So, turmeric is really not as effective as, we don't put any turmeric in. We put curcumin in it. Curcumin's the extract. Turmeric, but it just makes it very orange, even though it's only a percentage of the formula. So I have different herbs for different heart conditions, but I would also give some anti-inflammatories for this Pitta type, because I know he's inflamed, his muscles are inflamed, and the things that this person needs to change for the Pitta type: no tomato sauce, the nightshades. The nightshades are inflammatory in their own right. So I'm treating his inflammation and his high blood pressure simultaneously. His muscle pain must be gone, and then I could be sure that the inflammation in his arteries and his heart is also down once he tells me he has no more muscle pain. So I have to treat the muscle inflammation, because the heart, like I said, is a muscle. And so I would use that formula for just getting down the inflammation. Now, people could be a combination. People could have anxiety plus inflammation. So it gets more complicated, but we're breaking it down. And they could have kidney issues. They could have other issues as well that make it more complicated. But again, we're breaking it down for educational purposes. So that Pitta person should not have hot foods, hot spices, not even garlic. See, garlic's great for the overweight person who's got high cholesterol, because garlic thins your blood, but and helps with cholesterol, no doubt. We even have garlic capsules, powder capsules. But for this type, the person who's got the Pitta type, they're red, they're hot, their whole body temperature is warm, they even get hot and angry. We don't get, garlic would make it worse. See, that's where you have to understand what you're doing. Because if you think, oh, I have high blood pressure, and you go look on social media where it says 10 things to help with your blood pressure, then you're going to find that someone's going to say garlic. But that could make your blood pressure worse if this is the type of high blood pressure that you have. So we're going to get into more specifics on these herbs. I'm just trying to talk to you about removing the causes. So if you realize you're in this type where you are pitta type of high blood pressure, you get hot spices, the garlic, the chili pepper, and do things that reduce your inflammation besides the treatment, the herbal treatments. So the third type is the kapha type. Kapha type, he's a heavier guy, often has blood pressure and blood sugar issues combined. There's usually extra weight, and they have blockages, and often they have high cholesterol, sometimes fatty liver, sometimes gallbladder, but it's a blockage. And again, you can have blockage plus inflammation. You could have inflammation plus, neurological issues. You could have little combinations. In fact, all three can be taking place at the same time. You can have somebody who's has inflammation, has blockages, and has a lot of stress shooting up their blood pressure as well. Some people are all three, but that's a little bit outside. How to treat that's a little bit outside the scope of this class, but it's important. You can have these multiple combinations, and there could be other ones too. There's the cause behind the cause. So say the person's stressed. Well, what's stressing them? It could be the job. It could be the relationship. So you can always go deeper looking at these causes. But back to the third type, the kapha type. So what does he have to avoid? He's got the high cholesterol. He's got the blocked gallbladder. He's got narrowing arteries and had some chest pain. And doctor said if he doesn't change soon, he's going to have a heart bypass and surgery. So that person needs to have no animal protein at all, no more beef, hamburger, chicken, cheese, fatty food. And of course, they need to lose weight. So you have to put them on a weight loss plan as well. See, the other two types, weight may not even be the issue. They could even be thin. But this type, usually there'll be a weight issue, eating habit issue, junk food, fast food, just restaurant food with bad fat, which has contributed to the high cholesterol level, the fatty liver. So we got to treat the fatty liver. We got to treat the cholesterol. That's why I showed you that one tea there for cholesterol and maybe some liver herbs I have to put in there. You have to look at the liver enzymes and the bilirubin. If he's got liver issues, I'll put in some liver herbs, cholesterol tea, plus the heart herbs. And he's got to get exercising. This person needs to be walking. This person needs to be exercising. The first type, Vata type, she's just stressed out and nervous person. She doesn't need to exercise. She needs to relax, go to do some yoga class and close her eyes and do some breathing and just relax. See, and even the Pitta type, who's got the high blood pressure, if he goes to the gym, he's just got to push up his own blood pressure. He's pushing hard in the gym. Now, if that Pitta type is swimming in a pool, relaxing in the cool pool, getting a little workout, that can help lower his blood pressure. But he goes to the gym, pumping iron, that's going to put his whole blood pressure even higher. But the third type, the kapha type, that's what he needs to do. He needs to run. He needs to exercise. He needs to go to the gym. He needs to kick butt. He needs to start eating less, stop snacking, be basically a vegetarian, get rid of all this fried foods, fast foods, start cooking sometimes. Maybe the causes are just eating out. So then they get the high cholesterol, the fatty liver, the blocked arteries because they're never cooking at home. So the cause is the diet. And then what's the cause why he's not eating good? Because he's cooking. He's not cooking. So maybe you have to motivate the person to start cooking, or marry somebody who cooks, which is obviously a common option for many men. But, otherwise they got to cook. And going out to eat when you have cholesterol, fatty liver, and blockages in your arteries is no longer an option because you're getting it from the bad food in the restaurants, the bad fat in particular, the fried foods, the French fries, the hamburgers, the deep fried food, all that bad fat. Even if you think you're eating something good with some salad dressing and you're in a restaurant, they're using cheap oil. They're not buying nice avocado oil or sesame oil or olive oil. No, they're buying the cheapest oil they can get in a drum and adding like some spice to it so you don't really taste it, because they've got to make money. Otherwise, they can't. If they buy all nice ingredients and they can't make money selling, so they have no choice. They have to sell it cheap. They have to use cheap ingredients to be able to sell it cheap. So that person needs to stop, eating out and clear up. So now I'm going to show you. Here's another thing. This is also by herbmanteas.com, our sponsor. This is an Ayurvedic formula for inflammation. Sometimes I give that out too for chronic joint, muscle, and nerve inflammation. Very effective, very subtle, not as quick and fast as the other powder formula. So usually if somebody has a lot of inflammation, if it's not bad, but I know they're Pitta type, then maybe I just give them the tea. But if it's serious, then I'm going to give them the powder, which is more effective. And actually, the whole heart tea, Herbman Teas has a heart tea, but they're sold out. So I didn't even have it to show you. But there is a heart tea, which usually I throw in as well. But mostly, and if there is blockages in the kidneys, Herbman Teas does have some teas for kidneys that are strong diuretics. These are like diuretic herbs like, Gokshura and milk thistle also is good for. So there's some diuretic herbs. If we can see they're swelling, then we want to give them a diuretic herb too. Flush this water out, because that's can create pressure and lead to high blood pressure. And a doctor will also give you a diuretic. We're just using herbs for diuretics, but herbs work very well for diuretics. And instead of aspirin, we're using natural blood thinner. Very easy to thin your blood with herbs, and see that will help with swelling and help avoid, strokes, improve circulation, avoid blood clotting. Chandraprava is a formula of 26 herbs, which is made just for this. Arjuna is probably the best herb in the world for cardiovascular system. And then Gotakola is also circulatory. Now, when we come to the main formula, because the powders are much stronger than the teas. So all those teas I showed you, those are supplemental. Even if I had the heart tea, which herbmanteas.com, they're sold out of, so I don't have it. But these are supplemental. Now I'm going to show you the main herbs that I'm going to choose from if you have high blood pressure. That's why I had whole families where 3 or 4 people had high blood pressure together, and I gave them each one of these. So I have basically 3 different formulas for these 3 major types. And then I'll use the teas as supplemental. Maybe if there's water retention, use the kidney flush tea. If there's cholesterol, I'll throw in the cholesterol tea. If there's anxiety, I might use the chill out tea or sleeping tea. And if there's inflammation, I'll use one of those 2 products that I showed you there. But now I'm going to show you the main formulas that I use. Okay, let's see here. The main one is this one right here. And this one, because it's got this label, we know that this one now is for sale on Herbman Teas. There's the Herbman Teas logo. So when I see that logo on a product, I know it's been put up on the website. Not all of these Indian herbs are up on Herbman Teas, but this one is. See, it's got the Vata and Pitta. So that means I can use it for Vata and Pitta. Now, again, I can make custom formulas and I can adjust these, but this one is usually used for Vata and Pitta types. And it will not be good for somebody with a blockage. And there's the dosages: 1 or 2 teaspoons and half a cup of warm water, morning and evening. Take more as needed, reduce gradually as blood pressure improves. These are all Indian herbs. There are Arjuna, Shankpushpi, Gotakola, Sarpaganda, and Jatamatsi. Those are for the nervous system. Jatamatsi, Abrakbasma is a mineral, and Taruni is rose petals powder. It's just a little bit in there. So this is a very traditional Ayurvedic formula. The percentage of those herbs are very important. Sometimes I can make it custom, but that was what I'd give for a Vata or Pitta type. Now, if they're a Kapha type, see, we have a different formula, and we even have a little K up there for Kapha, and this improves cardiovascular function and controls blood pressure, improves circulation. and swelling, but the herbs are different. But we can see some similarities. Arjuna for circulation, Punarava is for swelling and blockages, Gokshura is for circulation. Now, Guggulu is a resin, which makes this formula dark, and then some ginger and black pepper. So this formula, if you give it to a Pitta type person, you could push up their blood pressure because it's very strong. It's very hot because it's got to break open and clear the circulatory system. And if your cause is not a blockage and you take this one, it's not good. In fact, if there's confirmed blockage in the coronary arteries, we have a slightly stronger one, which is more dark, see? And that's the more Guggulus in there, the resin. And we call it black coronary artery formula. And you can see Guggulu is high up on the list. Saraswati is actually a formula used for mental blockages. And there's Shilajit in here as well, which is used to really break up a fat and improve circulation. And there's Pushkar Mool. So it's actually a completely different formula. This one's really hot and powerful. So, you don't want to give something too strong to the person. So generally I pick one of these because the powders are so much more effective. You're not going to bring your blood pressure down much with a tincture unless it's nervousness and you're just putting little tinctures all day of chamomile or some passion flower in your tea, and that may help you relax a little bit and maybe help your blood pressure. But for practical purposes, a tincture is not going to bring your inflammation down. It's not going to unblock your arteries. So they're really not much use unless you're trying to be preventive and you're just taking some every day in your water. So the powders are stronger, much stronger than the teas. I really cannot treat most people's blood pressure with the tea. Even Herb Tea's heart tea, which is nice. It's a good tea. It could bring it down 5 to 10 points, but is it going to take care of any blockage? People try, I've already tried everything. And what have they had? They've just had hibiscus tea, or they take some Arjuna tea or hawthorn berry. And I admit in the Herb Tea's tea, there is hawthorn berry, hawthorn leaf, and hibiscus tea, and some other herbs, including a butcher's broom. And rosemary and ginger. So there are good herbs in it, but because it's tea, it doesn't have the same power as these formulas. The formulas are much more powerful because you're just ingesting the whole formula. You're not just taking an extract from it. So to conclude, the treatment has to be holistic. To get people's blood pressure down or your blood pressure down, you first have to identify, why do I have it? Am I inflamed? Am I nervous? Or am I blocked? Or am I a combination of the two? Or it could be even your kidneys, could be your colon, could be other causes as well. I mean, there's even some medications that can adversely affect your cardiovascular system. So you've got to get down to what the cause is, not just start looking for a tincture to take in the health food store. Once you've got that down and you've accepted, okay, in my case, it's probably my high cholesterol, my high, my excess weight, so then that's where you need to focus and get into those causes. If you know it's inflammation, then you need to focus on the inflammation. If you know it's anxiety and nervous system, then you need to focus on that. You need to do all that and change your life, change your diet accordingly, and take the herbs. That's why I'm successful, is because, one, we don't really sell most of these Ayurvedic products without an appointment, so I have to pick them. But basically, that's the treatment: diet, lifestyle, and herbs. All three have to change. And the herbs everything needs to match your type of high blood pressure. And the dosages need to vary based on the degree of your high blood pressure. I could give a big guy 2 teaspoons in the morning, 2 teaspoons in the evening. I could give a small woman 1 teaspoon in the morning, 1 teaspoon in the evening. Somebody who's just got mild hypertension is not bad. Maybe I just change the diet, give them some tea, and see how it goes. They're not even on meds yet. People are taking meds and their blood pressure is very high. Not only do they have to stay on the meds, but they probably have to take big doses of the herbs for a couple months until that blood pressure comes down. Then they can choose whether they want to reduce the medication or reduce the herbs, because eventually the herbs will improve the cardiovascular system if the diagnosis was right. See, the secret It's not that the herbs work or don't work. They work 100%. The question is, did we pick the right ones for you? And that's all based on the diagnosis. It's easy to treat people. The trick is to diagnose it and know what the causes are and get the people to get rid of these causes. Because if you've got high blood pressure from anxiety and you keep drinking the coffee and don't sleep at night, well, the herbs are going to have minimal benefit. So I have to get the person to remove the lifestyle and dietary causes that are leading to this condition. Any condition, it's the same for everybody. Well, I hope that helped you understand a potential and ability to treat hypertension. And the last thing I will say is don't wait until it's high. Don't wait until you've been on the meds for 10 years, because if the first medication you take doesn't work, they're going to give you a second medication, and then a third. I know people taking 3 medications and their blood pressure is still high. So that's because they never changed the diet and the lifestyle or removed the causes. So, maybe they're continuing with these causes and the blood pressure is going up and the doctor's just now stacking more medications on for you and nobody's removed the cause. I see it all the time. So I hope that helped you understand the importance of, changing your life, changing your diet, and having a professional diagnose you to give you the right herbal remedies. And it may be more than just one formula, because there could be other conditions that need to be treated as well. Your digestion, your sleep, your inflammation, your circulation, your cholesterol. Any of these could be just secondary conditions that need to be treated to make it an effective treatment. All right. Once again, thank you very much, ladies and gentlemen. Sorry about the interruption with the little kitty cat, but we made it through, and I wish you all the best of health and happiness. God bless you all.